A person who is healthy should have a blood sugar on average of about 80. This means that you have about 1 teaspoon of sugar in your blood. High blood sugar is caused by a lack of insulin. What controls insulin? The pancreas controls your insulin. If you have diabetes and you've done some research on it, you may be completely confused. If you looked up the definition of diabetes, you would see that it says that diabetes is hyperglycemia, which means high blood sugar. Why is diabetes so dangerous? Well, high blood sugar affects the blood vessels both small and large throughout your body. Diabetes most commonly causes issues in the retinas, kidneys, nervous system, and cardiovascular system. What could have caused your diabetes? Is a fatty pancreas to blame? If you have diabetes, this video is for you. Insulin takes extra sugar out of the blood and hides it in other places in the body. Insulin levels are rarely tested. In order to deal with the excess sugar, insulin has to work overtime. Insulin converts sugar into the fat cell. Then, it starts putting it into the subcutaneous fat superficial layer of fat just beneath your skin. Later, you could start developing ectopic fat, which is the fat outside of the fat cell and outside of the subcutaneous fat. At this point, the fat is being stored in the liver, muscles, and heart. Eventually, this fat will spill over into the pancreas. When this happens, you're also developing insulin resistance as a protective mechanism. What would be the first sign of diabetes? It's actually not prediabetes. It's something that comes before prediabetes. It's insulin resistance. Insulin resistance is like a pre-prediabetes, one of the first signs or clues of diabetes. If you can catch it at the insulin resistance stage, you can potentially avoid any further progression. The first indicators of insulin resistance include 1. Frequent hunger. 2. Carbohydrate cravings. 3. Not feel satisfied after a meal. 4. Urination at night. 5. Thirst before bed. 6. Feeling tired after eating. 7. Belly fat. Here's what you can do for insulin resistance and prediabetes. 1. Lower your carbs to less than 50 grams. 2. Stop snacking. 3. Cut back to 2 meals a day, intermittent fasting. 4. Get plenty of butyrate by consuming vegetables. 5. Get plenty of vitamin D6. Replenish your chromium, vitamin B1, potassium, low-load magnesium. How to reverse the damage caused by diabetes. Take 1 tablespoon of cinnamon, add 1 tablespoon of lemon, add 1 teaspoon of ginger in a cup of water. Drink this every day and eat healthy meals. In summary, carbohydrates and sugars are at the center of diabetes. Even whole grains, starchy vegetables, and natural sugars can cause adverse effects and contribute to diabetes.